Tonight, a KXAN in-depth report on a health concern for every single Texan. I'm Sally Hernandez, and this is the face of an epidemic. Baby Haley was just a few days old in this picture. She was too young to get a vaccine to protect her from whooping cough, but not too young to die from that disease. Now, it's important to explain what this story, Haley's story, is not about. It's not about a parent's decision to or not to immunize their kids for whatever reason. This is a story about your right to decide who knows those personal details and why. It's a choice Haley's parents say could save another baby's life. In a quiet town of Panhandle, Texas, near Amarillo, Rodney Throgmorton's home is full of noise. The good kind, with kids laughing and playing. But someone is missing.
But we think all the time about her.
They often wonder, what would Haley look and sound like? Would she be a quiet kid or as loud as her first cry, born here at home back in 2003?
Delivering my daughter like that, and it was so wild and crazy and everybody yelling, and it was the greatest thing of my life. And I can't think of anything that would come close to it.
A few weeks later, Haley couldn't even catch her breath, coughing till she was blue in the face. What Rodney didn't know was that he was sick with pertussis, also called whooping cough, and unknowingly passed it along to Haley.
I remember the first time when she did cough, and I remember thinking, that's not normal for an infant, for a baby.
Babies can't get their first dose of the whooping cough vaccine until 2 months. Haley lived only 6 weeks. Rodney lives to tell her story.
Well, I just wanted to do anything that I could to raise awareness about pertussis.
Driving 500 miles to Austin.
Identify yourself for the record.
Rodney goes to great lengths to draw attention. This time it's at the state capitol for a hearing over the state's shot registry, known as MTRAC.
Thank you very much for sharing your story.
MTRAC allows the Texas Department of Health to store your vaccine records electronically, but you have to sign up for it. Today there are shot records for 7 million children and 270,000 adults. That's an opt-in rate of 92.8% at birth.
Our statewide immunization stakeholder meetings.
But Nita Nakra with the Immunization Partnership wants to change that.
So changing the consent process from an opt-in to an opt-out process will ensure we have just a more robust immunization registry.
An opt-out process would mean all your shot records would become part of the registry without you signing up for it until you opt out.
And I think that your health records should be private.
But parent Rebecca Rex doesn't like that. She's been fighting the opt-out idea since 1997 when lawmakers first approved the registry.
And I believe that parents should be allowed to make informed choices about their health care and the health care of their children.
But healthcare workers say it's a matter of public health in the wake of outbreaks.
We're looking for a better means of controlling and maintaining those outbreaks.
And Texas is not immune. Last year, a measles outbreak in the Dallas area with 21 cases linked to a mega church. Or an H1N1 flu strain so severe in 2009, it forced an Austin hospital to set up tents outside for the massive number of patients. And then there's whooping cough. An outbreak so dangerous, there was a recent statewide health alert. In 2013, Travis County reported 311 cases. So far this year, 50 cases and 1 death, an infant. The first pertussis death in Travis County since 2003.
If providers as well as public health officials have good quality and quantity data, they can access that data real time, determine who's immunized, who's not immunized, and where there might be pockets of vulnerability in the community. A lot of times it's done manually. That takes a lot of time. And when that happens, the outbreak could be spreading.
Spreading to babies too young to be immunized. Like little Haley.
I got to get her to take her first breath, and I got to be the first face she saw. But I also won't get to walk her down the aisle. I won't get to escort her at the homecoming queen thing or anything of those things, all the things that are special between a father and a daughter.
Rodney Throgmorton's testimony before the Texas House Committee was important because lawmakers could use it to craft legislation next session. But this is an issue they've considered over the last 9 sessions at the state capitol. And as the state's population grows, so have outbreaks of deadly diseases like Haley's and the understanding that a new approach is necessary. Soon. Sally Hernandez, KXAN News.
And this weekend on our political program, State of Texas in Depth, an Austin lawmaker talks about legislation he expects to be filed next session at the Capitol to make the registry an opt-out system.
How likely do you think it is that it will pass, considering we've had outbreaks recently?
Well, I think that increases the odds that it will pass if you understand how important it is for as many people as possible to be entered into the immunization registry, because that.
Join our Josh Hinkle as he sits down with Representative Elliot Neistat, the Vice Chair of the House Public Health Committee. That is this Sunday morning at 8:30 on State of Texas in Depth. And if you want to let your lawmaker know what you think about this issue, go to KXAN.com. We'll tell you how to contact them. And we also have a link if you want to sign up for the state's vaccination registry, plus an interactive feature to see how many cases of whooping cough are reported where you live. That is all online right now in this story at KXAN.com.